Hello, am I
Yes,
audible po?
ma'am.
Okay.
po.
Okay.
One moment, share ko lang po yung screen. Nakita na po yung screen, ma'am.
Yes po, ma'am.
Okay. So, good afternoon, everyone. Good evening. I will report about the factors affecting drug absorption. So, before I will proceed, let me just define the terms. So, absorption, this is the process of movement of unchanged drug from the site of administration to systemic circulation. And next is bioavailability. So this is an important term to define in the topic of absorption because it is the extent to which absorption occurs. So bioavailability can be defined as the fraction of administered drug that reaches the systemic circulation. So ito yung mga amount ng drug na na-absorb. And so there are factors that is affecting drug absorption. So there are two main factors, that is the pharmaceutical factors and then the patient-related factors. And so under the pharmaceutical factors, you have the chemical factors, and then we have the physical chemical properties of drug substances, and we also have the formulation factors. So under physical chemical properties, we have drug solubility and dissolution rate, particle size and effective surface area, polymorphism and amorphism, solvates and hydrates, salt form of drug, and ionization state. Then under formulation factors, we have this integration time, manufacturing variables, nature and type of dosage form, pharmaceutical ingredients, the product age, and storage condition. So I've mentioned earlier, we have patient-related factors. So these are the factors: gastric emptying rate, intestinal motility, drug stability in the GIT, intestinal transit, blood flow to GIT, effect of food, the pH and surface area, age of patient, and the disease. So to start with the chemical factors, so this is, there are a variety of chemical options that can be used to improve the stability and systemic availability of drugs. So we have the example for esters and penicillin. So for esters, so these are prepared as acids and bases. And to produce more stable derivatives, so this the stability and solubility of those both acids and bases will increase when they are in the form of salt. So there is a chemical alteration or maging salt form siya para mas maging soluble yung drug. And then we have the physical chemical properties, the drug solubility and dissolution rate. So the rate determining steps in absorption of orally administered drugs. So these are the rate of dissolution and the rate of drug permeation through the biomembrane. So for example, glycofulvin, which is in the form of, this is a particle form that follows the solution in the absorption of its active form. And we also have neomycin, which is in solution form. In order for it to be absorbed in the bloodstream, it will undergo permeation. So important prerequisite for absorption of a drug is that it must be present in aqueous solution, and this depends on drug aqueous solubility and its dissolution rate. Next up is the particle size and effective surface area. So the smaller the particle size, so there will be much greater surface area. So that means there is a more intimate contact with the solid surface and aqueous solvent, thus higher dissolution rate. So pag higher dissolution rate, there is an increase in absorption efficiency. So for example is that of chloramphenicol sa particle size. So, yung mga particle size reduction, so it has been used to increase the absorption of a large number of poorly soluble drugs. So yun example, yung sa chloramphenicol, so there is a particle size reduction. And then we have another physical chemical properties, the polymorphism and amorphism. So if you say polymorphism, it is in a crystalline form, and then ang amorphous is no crystal structure. So yung amorphous, this is a more soluble form, which is rapidly dissolving and readily absorbed. And the crystalline form is less soluble, slower dissolving, and it is not absorbed to a significant extent. So yung amorphous forms, they generally dissolve faster than the crystalline forms because there is no energy that is needed to break up the crystal lattice. So amorphous forms generally dissolves faster than crystalline forms. As what I've mentioned, there is no energy to break up the crystal lattice, and for this reason, the amorphous form is often preferred over the crystalline form and several drugs, so including the hydrocortisone and prednisolone that are marketed in amorphic form. Also, an example is novobiocin. So another physical chemical property is being solvates and hydrates. So during their preparation, drug crystals may incorporate one or more solvent molecules para makaform ng solvates. And the most common solvate is water. So if water molecules are readily present in a crystalline structure, so the tendency is that crystals attract water to initiate the dissolution process. And the crystals tend to dissolve more slowly than the anhydrous forms. So solvates, they have greater solubility than other non-solvates. Example is the chloroform solvates of cruciforvine and panthanol solvate of hydrocortisone, fluorocortisone. And next is the salt form of the drug. So salt of weak acids and bases, they have much higher aqueous solubility than the free acid and base. So therefore, if the drug can be given as a salt, the solubility can be increased and the solution thus can be improved. So as what I have mentioned earlier about the chemical form, so pag maging salt siya, mas readily absorb yung drug. And so as we can see here on in the figure, so this shows that the potassium salt has the highest solubility. And the next is the ionization state. So the simplest principle of this is that yung mga ionized drug, they have higher absorption, and the ionized drug, they have lower absorption. And the next is the formulation factors. So one of the formulation factors is the disintegration time. So when you say rapid disintegration, so that is important in rapid absorption. Next up is the manufacturing variables. So it would also depend on the method of granulation. So in wet granulation, that yields a tablet that dissolves faster than those made by other granulating methods. But wet granulation has several limitations like formation of crystal bridge or chemical degradation. Other superior resin method named the agglomerative phase of comminution that involves grinding of drug till spontaneous agglomeration and granules are prepared with higher surface area. So, di ba kanina, I have mentioned that the smaller the particle size, mas greater surface area, thus greater ang absorption niya. And next is of the formulation factor is the nature and type of dosage form. So in this figure, we can see that absorption from the slowest up to the fastest. So your tablets will undergo disintegration, then to become granules. Then undergo the aggregation to become a fine particles dissolution that then maging drug in a solution siya before siya maging ma-absorb sa biomembrane. And so tablets, ito yung mas low na absorption if compare natin sa solution. So we have here the levels ng slowest up to the fastest absorption from tablets, capsules, powders, suspension, emulsion, and solution. Next, formulation factor is the nature and type of dosage form. So as a general rule, the bioavailability of a drug from various dosage form decreases in the following order. So the solution, emulsions, suspensions, capsules, tablet, coated tablets, intercoated tablets, and sustained release product. And next is the pharmaceutical excipients. So changing an excipient from calcium sulfate to lactose and increasing the proportion of magnesium silicate increases the activity of oral phenytoin. So it would also depend on the pharmaceutical excipients, and systemic availability of thiamine and riboflavin is reduced by the presence of fuller earth. And also the absorption of tetracycline from capsules is reduced by calcium phosphate due to complexation. And next formulation factor is the product age and storage condition. So product aging and improper storage conditions, they can adversely affect the bioavailability. So they can result into precipitation of drug in a solution, thus decreasing the dissolution and the absorption of the drug once taken. And then we have the patient-related factors. So the gastric emptying rate. So when anatomically, a swallowed drug rapidly reaches the stomach. Eventually, the stomach empties its contents into the small intestine. And because the duodenum has the greatest capacity for absorption of drugs from the GI tract, a delay in gastric emptying time for the drug to reach the duodenum will slow the rate and possibly the extent of drug absorption, thereby prolonging the onset time for the drug. So some of these drugs are penicillin that are stable in acid and decompose if stomach emptying is delayed. Another example is aspirin that may irritate the gastric mucosa during prolonged contact. And gastric emptying rate is faster in case of solutions and suspensions than solid and non-disintegrating dosage forms. Next, patient-related factors is these are the factors that can influence gastric emptying rate. So we have the volume of the meal, composition, the physical state and viscosity of meal, the temperature, gastrointestinal pH, electrolyte and osmotic pressure, body posture, emotional state, and disease state. So next factor is the intestinal motility. So normal peristaltic movements mix the contents of the duodenum, bringing the drug particles into intimate contact with the intestinal mucosal cells. And when the drug must have a sufficient time, or that is the residence time at the absorption site for optimum absorption. In case of high motility in the intestinal tract, as in diarrhea, so the drug has a very brief residence time and less opportunity for adequate absorption. So yung diarrhea will affect absorption of the drug since mas faster yung motility. So faster ma-excrete yung drug, so there will be no sufficient time or the resident time at the absorption site. And next is the drug stability in the GIT. So metabolism or degradation of enzymes by or chemical hydrolysis may adversely affect the drug absorption and thus reduces the bioavailability. So there are enzymes in our body that causes degradation of our drugs, yung mga CYP, also the gastric acid and this is a general problem with orally administered drugs since they will pass through the GIT first. And then we have the intestinal transit. Long intestinal transit time is desirable for complete absorption of drug. Example for enteric-coated formulation and for drugs absorbed from specific sites in the intestine. Peristaltic contraction promotes drug absorption by increasing the drug membrane contact and by enhancing the solution, especially of poorly soluble drugs. So this is influenced by food, disease, and drugs. Example, yung metoclopramide, which promotes intestinal transit and thus enhanced absorption of rapidly soluble drugs, while anticholinergic retards intestinal transit and promotes the absorption of poorly soluble drugs. And next is the blood flow to the GIT. So once the drug is absorbed from the small intestine, it enters via the mesenteric vessels to the hepatic portal vein and the liver prior to reaching the systemic circulation. So any decrease in mesenteric blood flow, as in the case of congestive heart failure, will decrease the rate of drug removal from the intestinal tract, thereby reducing the rate of bioavailability. And also food, it can affect the absorption. So the presence of food in the GI tract can affect the bioavailability of the drug from an oral drug product. Digested foods contain amino acid, fatty acid, and many nutrients that may affect intestinal pH and solubility of drugs. So some of the effects of food on bioavailability, so this include delay in gastric emptying, stimulation of bile flow, change in the pH of GI tract, increase in splanchnic blood flow, a change in luminal metabolism of drug substance, and the physical or chemical interaction of meal with the drug product or drug substance. And next is the pH and the surface area of the GIT. So from the mouth, which has a small area, surface area, is lipophilic, neutral, and basic drugs are absorbed directly in circulation. Sa mouth, then in the stomach, that is not too large surface area, the lipophilic, neutral, and acidic drugs are absorbed, but lesser extent than the small intestine. Then for the large intestine, small surface area, and all types of drugs are absorbed, but to a lesser extent. Then we have the liver. This is the major site of drug metabolism. And then the bile that aids in absorption of lipophilic drugs, routes for active secretion of polar drugs and metabolites. And we have also sa rectum, much smaller surface area. All types of drugs are absorbed. About half of the absorbed drug goes directly to systemic circulation. And then we have the age of patient na maka-affect. So in infants, the gastric pH is high and intestinal surface and blood flow to the GIT is low, resulting in altered absorption pattern in comparison to adults. In elderly persons, causes impaired drug absorption include altered gastric emptying, decreased intestinal surface area, and GI blood flow. Higher incidence of achlorhydria and bacterial overgrowth in the small intestine. And then lastly is the diseases. So this can also affect absorption of drugs such as in Parkinson's disease, patients taking the TCA or tricyclic antidepressants or antipsychotics, HIV/AIDS patients, congestive heart failure, and Crohn's disease. So on the diseases, just one moment. So sa diseases, yung mga may Parkinson's disease, they have difficulty in swallowing. So this will greatly diminish, and they have also diminished gastrointestinal motility. That's why maka-affect yung absorption ng drug. And sa mga TCAs and antipsychotic drugs, yung mga patients na nagtitake of these drugs, they have reduced gastrointestinal motility and even intestinal obstructions. And delays in drug absorption, especially with slow release products. Sa mga HIV patients naman, they are prone to a number of gastrointestinal disturbances, such as increase in the gastric time, diarrhea, and achlorhydria. And then for patients with congestive heart failure, they have persistent edema, and they have reduced plaque blood flow and develop edema in the bowel wall. Also in the Crohn's disease, this is an inflammatory disease of the distal small intestine and colon. So absorption also happens on those areas, so that's why it also affects the drug absorption. So that is all about my report for today. Thank you very much.
Okay, thank you, ma'am. You may unshare the screen now. Let's just wrap up the factors discussed by Ma'am Venus. We have here again, we have factors affecting drug absorption. We know that very well when you say drug absorption, that's the transfer of drug from the site of administration to the bloodstream. And these are, again, the factors affecting drug absorption. We have two. We have pharmaceutical factors and patient-related factors. Now, under sa pharmaceutical factors, we have here physicochemical properties of the drug substances. So what are those? We have here drug solubility and dissolution rate. So definitely, before the drug is absorbed in the bloodstream, it needs to be in aqueous solution. So it needs to be dissolved first. Now, if we have problem with our drug solubility, then that means we will also have a problem with our absorption rate. And then number two, particle size and effective surface area. Most likely, if we have smaller particle size, we have larger surface area, that will mean the drug's dissolution rate may increase. So that will help in the drug solubility actually. And then we have polymorphism and amorphism, wherein our drugs may exist in different forms, especially our crystals. So when you say polymorphism, we have different forms for our crystals, and we need to determine which among these polymorphs are stable for it to be absorbed quickly. Okay? So kapag yung example, yung ating drug, merong polymorphs A, B, and C, hahanapin natin doon, i-differentiate natin which among them is stable or unstable. So syempre yung stable yung gagamitin natin. Now we also have salt form of our drug. So most of our drugs are being formulated in their salt form to aid in the dissolution also. So most of our acidic drugs are formulated as either sodium or potassium salts, and our basic drugs are formulated in their hydrochloric acid salts. Again, that is to aid also in the dissolution of the drug. And that means if they are easily dissolved, they can cross the barriers and can reach the bloodstream. So that it actually includes the pKa of the drug, the acidity and basicity of the drug, as well as the GI pH. So we have drugs that are actually affected by our gastric acid, and that will hamper their absorption. And the lipophilicity of the drug, since our cell membranes are lipophilic in their character, so definitely it is selective. Most of the drug that can pass through easily are lipophilic also. So we need to consider that in the absorption of the drug. And we have drug stability. So we have like enteric-coated drugs nowadays protected from our gastric acid for the drug not to be destroyed easily, and it can increase our absorption. Okay. And then, aside from the physicochemical properties of our drugs, some substances, we also have the formulation factors. So if the drug is formulated as either tablet or capsule, we need also to give consideration to the disintegration time and then the dissolution time also. And then other manufacturing variables, the excipients that we use can also affect our absorption, the nature and the type of dosage form, and the product age and storage conditions. So these are all the pharmaceutical factors that we need to consider for us to have an efficient absorption. And then we also have patient-related factors such as age. So definitely, if bata or matanda, there will be a variation in the absorption rate. So medyo slowed down yung kanilang absorption. And then we have gastric emptying time. We have here factors that affect gastric emptying time. So what are this? Example type of meal. Ito nakapasunod ito. So carbohydrates yung pinakamabilis in terms of the gastric emptying time. And then we have the proteins and the fats. So remember, gastric emptying time is the time wherein the drug is being transferred from the stomach to the intestine. So remember that our intestine is our like major site of absorption. Okay, so after carbohydrates, again we have the proteins and we have the fats. Now the temperature of the food that we eat can also affect gastric emptying. So if you have increased temperature, that means there is also increase in emptying rate. The body position also lying on the left side decreases our emptying rate while the other side promotes it. So if we want to have a quicker absorption, then we can adjust our body position also. The GIT pH also retarded at low stomach pH and promoted at higher alkaline pH. Okay, the more acidic our stomach is, the longer the gastric emptying time. And that's the vice versa for the alkaline pH of the stomach. Now, aside from the condition of our stomach and the food that we eat, we also have here the emotional state. So anxiety promotes, whereas depression retards it. So if we have anxiety, then there will be increased gastric emptying time for us, and that means there is a quicker transfer, faster transfer to the intestine, and that will lead to increased this absorption rate also. And then again, that's the other way around if the patient is depressed. And then we have disease states also that would affect gastric emptying, like gastric ulcer, hypothyroidism will decrease the gastric emptying time, while if the patient has duodenal ulcer and the hyperthyroidism, it's the other way around. It will be a faster gastric emptying time also. Okay, so aside from that, let's go back to our patient-related factors. We have intestinal transit time. Okay, so again, our intestine, our major site of absorption, and definitely if we have faster transit time, that means a faster absorption also, but not in the case of diarrhea, since masyadong mabilis yung peristalsis hindi na din maa-absorb yung drug, no? So, mas mabilis yung metabolism and excretion if masyadong mabilis yung peristalsis. The GIPH, I think na-mention din siya in the physicochemical properties of the drug. If we have a lower pH in our stomach, that will retard the gastric emptying time, and that means medyo tatagal yung absorption of the drug. And na-mention na din ang disease state, the blood flow through the GIT. So definitely, since we are transferring the drug from the site of administration to the bloodstream, blood flow will dictate also the absorption. Okay? So if we are hampered blood flow in our GIT, that would mean there is also an effect in the drug absorption. So the GI contents, we have other drugs, diba? We have drug-to-drug interactions, drug and drug-to-food interactions. We also need to consider if we want an efficient drug absorption. The fluids also na sinasabay natin with our drug can also affect drug absorption. And other factors like presence of enzymes like luminal, gut wall, and hepatic enzymes may hasten or speed up metabolism of the drug, example, the first pass effect, and that will lead to decreased absorption, okay, of the drug. Kasi before absorption, they will be metabolized and excreted. So itong lahat na ito yung mga factors affecting our drug absorption. Okay? So yun lang yung ating lesson for this evening. Evening na kangit-ngit naman. Okay? So you have questions or clarifications sa kanilang reports? Pharmacokinetic parameters, a review in the pharmacokinetic parameters and the drug absorption. Meron ba? I'll be posting an activity and wait lang. Message ito. Okay. Sige. I'll be posting also the link of the recorded discussion sa Google Classroom na lang para ma-review niyo siya. And then, again, I'll be posting activity number 2. Pero hindi ko pa naman siya ipapasa ngayon. So you have enough time to do this. And then we will discuss the answers next meeting. Ano date ngayon? 17. Upload.